finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo, no BS is allowed. Now, let's welcome your hosts, Doctors May and Tim Hindmarsh.
All right, everybody. This episode is something we've been wanting to do for quite a while. This is something big and dear to our hearts. And, of course, if you know us, not without us crossing the controversial line. So we're not afraid to dive into any topic. The timing was perfect for this, and you're going to love today's guest, Dr. Grossman, as we get into the transgender discussion.
Well, we are excited. Everyone buckle up. You're going to, you might actually need the 5-point harness today. We have Dr. Miriam Grossman with us. She's a psychiatrist who has been fighting the battle for the last 15 or 20 years with regards to what's going on in this bizarre world of sexual identity, transgenderism, gender identity, especially with regards to children. She's an adolescent and adult psychiatrist who has practiced for many years. She's in private practice. And we're going to have her tell us a little bit about herself here in just a second. But we are extremely humbled and excited to have her here. She was recently on Matt Walsh's show, What is a Woman? Which, if you have not seen that, it's on the Daily Wire. It is worth the subscription. I watched it twice. And it's one of those experiences where you're not sure if you're supposed to laugh or cry, so you just do both. So welcome, Dr. Grossman. Thank you so much for joining us on BS Free MD. And if you could give us a little history of what you've done with your life and where you're going now. Thank you.
Okay. Well, thank you so much, Tim, and thank you, May, for that introduction. And thank you so much for having me on your podcast. Let's see. You want to know basically, I guess, how I got into the whole fighting the prevailing narrative of gender ideology. I got into it via my interest in sex education, which I got into because I was working as a psychiatrist at UCLA. For the students that were there. And it came to my attention over the years that I was there that these kids were having multiple reactions, psychiatric symptoms like anxiety and depression that were related or even a direct result of their sexual decisions, their decisions about their behavior and hooking up and getting STDs and getting exposed to HIV and getting pregnant and so on and so forth. And so I started at that point looking into what these kids are actually taught and what the student counseling center that I was working in at the time were teaching kids and what the health center was teaching kids. And I discovered that there's a lot of ideology that's being presented to young people in the form of their health education. And instead of getting the accurate medical facts that would be protecting them, they were getting a different message. And what I mean by that is that I'll just give you one example. I know that you guys are doctors, and a lot of your listeners, I'm assuming, are doctors, nurses, and other medical professionals. For example, we have known for a long, long time, right, that the cervix of a young woman, a girl, is immature. We have known that the cervix in a young girl has an area called the transformation zone, and that is only one cell thick. And as she gets older, that zone gets smaller and smaller. But the younger she is, the larger that transformation zone, And that means that she is more vulnerable to infection. Her cervix is more vulnerable to infection with HPV, chlamydia, you name it, all the different sexually transmitted infections, which therefore tells us that it is best to delay sexual behavior. And it also tells us that girls are more vulnerable than boys. That's just the biology of it. It's not ideology, it's not sexist, it's not anti-feminism. It is just medicine, gynecology, histology, whatever you want to call it. It's science. And I was very alarmed to see the number of young women that were coming through my office who were infected with a sexually transmitted infection, and they needed treatment, and it could possibly affect their future. Um, and when I spoke to them about this, they had no clue about the possible vulnerability that they may have compared to the guy that they're hooking up with. So that's just one example. There were many more. And I ended up writing a book called Unprotected. A campus psychiatrist reveals how political correctness in her profession endangers every student. I know, really long title. I didn't like it, but I didn't have a choice. And every chapter of that book dealt with a different issue, such as what I just mentioned about the cervix. There's a chapter on abortion. There's a chapter about fertility. There's a chapter about religious faith and abortion, and just these various topics that I felt were misrepresented to young people, and misinforming them regarding the information that they needed to have to stay healthy and to stay well. So I know I'm taking a long time in answering your question, but from that experience at the student the student counseling, mental health services, I then got into studying sex education. And among many other things, I discovered how young people were being taught about gender. And this was back in, I wrote another book called You're Teaching My Child What? And that came out in 2009. And in that book, one of the things that I warned parents about was that kids were being told that that being male or female is completely separate from biology. That identifying as a girl or a boy, a man or a woman, can be seen as something that is completely divorced from chromosomes and hormones and so on, which of course is not correct. So that's how I got into the whole gender ideology thing.
I'm surprised. I'm thinking back, just from our experiences in family practice, urgent care, back in 2009, they were starting to teach us. I mean, now it's pretty mainstream and it has been for the last 3 to 4 years in, even rural conservative America where we are. But, wow, I didn't think it was going back as far as 2009.
Oh, 09, no, but 09, May, 09 is only when I wrote about it. It was going on much before that as well. So organizations like Planned Parenthood, the organization SIECUS, which is the Sexuality Information and Education Council of the US, and other prominent sex education organizations were pushing the gender ideology probably since even the late 1990s. So the gingerbread man, this has been, well, first of all, these ideas have been around for a long time. You probably heard of John Money, and it sort of came out of nowhere, but that is not correct. It didn't happen suddenly. It's just being noticed now.
You mentioned John Money, and that I think is really key to sort of where a lot of this came from. Can you, for our listeners, and I'll just say, like, probably we think about 50% of our listeners are sort of non-medical based. It's kind of an interesting mix we have. Let's go back to where this sort of all started to unravel and the theories behind this transgenderism with John Money. Can you explain to everybody sort of who he was and how that started?
Yeah. Very, very important for people to understand this. Well, prior to John Money in the 50s, 1950s, the word gender was a grammatical term. Okay, so it was used to describe words such as nouns, in certain, not in English, but in Spanish and French and other languages, nouns and other terms have are masculine or feminine. For example, in French, the word table, I think, is feminine, and anyone that's taken Spanish and French in school knows what a pain in the neck it is to have to be able to identify the
Oh, yeah.
gender of words. So John Money came along and he took the word gender and he used it for the first time to apply to humans. And he used it in such a way to describe a person's inner experience of being male or female. And the reason that John Money was interested in this is he was a psychologist, and um, he his area of expertise and interest was hermaphrodism, which we now call intersex. So a hermaphrodite, a true hermaphrodite, is very, very unusual. It's someone that is born with uh, with both male and female reproductive organs, or parts of both male and female reproductive organs. And often at birth, they will have ambiguous genitalia, so that, um, when they're born, it's not completely clear. The penis may be very, very small, or the clitoris may be very prominent, and it's not clear if this is a biological male or female. And that's where the term that is so misused right now, the term assigned sex at birth, which is now, it's been co-opted by the gender activists, and it's applied to everybody. Well, that is not correct. That is a term that was originally used in reference to these kids who it was not clear at birth if they were male or female. It's very rare that this should occur. And so the John Money specialized in the care, the treatment of these kids and their families. And he would, along with his team at Johns Hopkins, he would advise parents on what their options were and what they should do and how they should raise the child, and so on and so forth. And he came up with his famous gender theory, and this was really his life's work. His life's work was to promote his idea that we are all born gender neutral, that we're like a blank slate, and that a newborn child could just as easily be raised as a male or a female. That it was all due to it was the nature nurture debate. So in his opinion, it was all about nurture and not at all about nature. So it didn't matter chromosomes, hormones, prenatal environment, and so on. He said it was nurture. It was all about how whether the kid is put in, to a pink or a blue blanket, and what the expectations are from the parents in terms of whether this is a boy or a girl, what toys they're going to give the child, what messages the kid is going to get from the family, from school, from relatives, from church, about what it means to be male or masculine, or male or female. So John Money felt very strongly that it was all about nurture, it was all about environment. Now, I'm just going to add something that's very important here in the story, and that is that John Money himself seems to have struggled with his own gender. And what I mean by that is that John Money was raised on a farm outside of Auckland, New Zealand, and he was raised by a tyrannical, alcoholic, violent father. And his father used to beat John's mother as well as John. And uh, uh, it sounds like he had a very horrific upbringing because of that, his father, and that his father was his only role model. Otherwise, he was surrounded by women. And later in his life, when he had already grown up, he wrote about that, and he said that uh, he struggled with. He said that he bore the mark of man's vile sexuality. I'm quoting here. I don't know if I'm getting every single word correct. I think I am. He wrote that he bore the mark of man's vile sexuality, and that he wondered if the world might not be a better place if not only your theory that postulated that it doesn't matter what genitalia you have, it doesn't matter what your chromosomes are. Your environment can make you into a different kind of person. So yes, so basically, that John Money uh, was the male model in his life as a boy was an extremely negative figure, and this was his role model for masculinity. And according to his later writings, we see that he most likely suffered from what we would now today call gender dysphoria. And that when we look at that and we consider that, it makes sense that he would come up with gender theory, which stated that even if you have certain chromosomes and you have certain the genitalia that go along with those chromosomes, it doesn't necessarily mean one thing or the other about being male or female or masculine or feminine.
Okay, I have a couple of questions with that. First of all, I think that there's something more powerful than randomized controlled trials. I think it's called common sense. So when you have obviously different chromosomes, obviously different genitalia, obviously different body shape and muscle mass and all of these things, and you can take chromosomes from virtually every cell in your body and say that that's a male or a female cell, why would people buy into something that's so obviously counterintuitive to what you see genetically? Like, that's what I don't understand. Like, what was the appeal? Like, I understand, though I personally don't agree with it, I understand the appeal to abortion. I want to be a woman who can have sex with whoever she wants and be on par with men where I never have to raise a child. Okay. I get that. That seems like a fairly obvious motivation. But like in the scientific community, why would people want to buy into this idea that goes against like everything that's obviously demonstrably real that you can test?
Okay, so Tim, of course, that's a great question, but let's just go back here. We have to go back to the 50s and 60s and 70s when gender theory was, um, introduced by John Money and promoted throughout the scientific community. Now, at that time, this was before the biotech revolution. At that time, there was the belief that the Y chromosome is essentially empty. The Y chromosome was considered a genetic wasteland at that time. We know much better now. We know that the Y chromosome is filled with genetic information. But back at the time of John Money, and for quite a few years after John Money, it really it was a feasible argument, that nurture was much more important than nature. And there was at that time it was a huge debate. Feminism was also involved with promoting the idea that it was all about nurture and not about nature, because early feminists really believed that um, that women have less opportunities. When we talk about the differences between male and female being fixed and being genetic and being hormonal, etc. So I want you just to consider that the science, it was a different scientific world at that time. Now, not everyone accepted John Money, just like not everyone accepted Kinsey. There were people that spoke out against it for sure, but John Money was a very strong voice, and he really was able to disseminate his ideas widely. He was writing a lot. He was speaking. He was lecturing. He was picked up by the the non-medical, just the regular media outlets, and his message came out, and people believed it, and people followed it for decades until it was exposed as being a hoax. So I guess you didn't get any of what I had said about the Reamer twins.
No,
No,
that's
yeah,
the next.
I was
That was
gonna
the next
say
question.
he did an experiment that failed massively, which was that. Yeah.
Okay, so you had asked me how the scientific community could have accepted this, and one big reason why it was accepted is because there was John Money uh, uh, was he was contacted by a family that would end up being the answer to his prayers, so to speak, because until this family, the Reamer family, contacted him, he was unable to definitively prove his gender theory. That would be extremely difficult. How do you actually prove, how do you take two kids that have the same genetic endowment? That, you would have to do this, the same nature, the same nurture. You would need identical twins raised in the same family. And lo and behold, that's the family that ended up on John Money's doorstep. And what happened is that the Reamer family in Canada, they gave birth to twin boys. The boys were absolutely fine. They went to have circumcision when they were 8 months old. Something went wrong with the equipment. The first twin that was having his circumcision was Bruce. His penis was burnt off. It was literally burnt off. His parents, as you can imagine, were in shock, didn't know what they were going to do. They took him home. The other twin didn't have the circumcision, so they had identical twins. One who was, untouched in terms of his, physically fine, and the other, his penis had been burnt off in this horrific medical accident, and they didn't know what they were going to do. One day they heard John Money on television talking about gender theory, and John Money announced that a boy could be raised as a girl. And they immediately thought that this is the answer to their prayers. They went down to see John Money in Baltimore, and they took his advice. John Money immediately told them to change Bruce's name, to give him a girl's name, to dress him in frilly dresses and pink dresses, and give him only girl toys. Now, this is the 60s, mind you, so we have all the gender stereotypes going on, and that's what they agreed to do. And they took the twins home. They changed Bruce's name to Brenda. They began to only refer to him as a girl female pronouns, little girls' clothing, dolls, et cetera, et cetera. And he also had to, John Money told them to have him castrated, to have his testicles removed. And he explained to the Reamers that as Brenda grows up, he will at some point need to be placed on estrogen to go through female puberty. And he reassured them that everything would be fine. He told the Reamers that they must never, ever tell Brenda or Bruce what had happened. They must never tell this child that he was born as a male. Now they agreed, and I just want to highlight here that this was a blue-collar family. That the parents had not gone beyond high school in their education. They went down to a big, prominent university, Johns Hopkins. They met with the quintessential, sophisticated, well-spoken, famous Professor John Money. So, of course, they're going to listen to what he had to say. And, of course, they were going to trust him. Well, that ended up being probably the biggest mistake they ever made, aside from getting the circumcision, because they ended up trying to raise Bruce as a girl, as Brenda, and they would return every year to see John Money and report back to him how things were going. And then John Money had an ongoing, report that, or articles that he would report back to the scientific community on how this experiment was going. And he consistently reported that the twins were doing great, and that so-called Brenda, I'm going to call her Brenda just for convenience, was doing fine as a girl, that she was adjusting, that she had feminine behaviors, that all her friends considered her a girl just like them, that she was doing fine at school and at home. The thing is that nothing could be further from the truth. From an early age, and we know this, let me just give a plug here for this very, very important book. The author is John Colapinto. The name of the book is As Nature Made Him, The Boy That Was Raised as a Girl. Very, very important book. Your listeners should get it and read it. So basically, as the years went by, Brenda was not at all happy as a girl. She was preferred to play with her brother's trucks and other so-called boy toys. She didn't like wearing dresses. She would tear the dresses off. She liked to do all the boyish kind of things. She liked to get dirty and get rough, and she was very domineering. Even compared to her brother, she was more of the domineering twin, aggressive. Her friends, she had a lot of troublemaking friends. The kids made fun of her. She was very masculine in the way that she talked and her gestures, the way that she walked. She preferred to urinate standing up. She would try to urinate standing up. She said that she wanted to be a sanitation worker when she grew up. I mean, it's almost, there were just many, many indications that this child. I'm sorry.
No,
we're good.
That's okay.
Yeah, let me just, if I can, just ask a question on that. So, all of these these quote masculine behaviors, I want to be a garbage man, I'm aggressive, etc. That was all pre-puberty in a child that had absolutely no idea that they were phenotypically male.
That is correct. This was all pre-puberty. That's correct. Pre-puberty. And without knowing, or at least consciously, I mean, I guess if you're very Freudian, you might say that, that on some level there was this memory, but let's put that aside. Okay, so on a conscious level, this child did not know that he was born male, that he had XY chromosomes, and that whole, no, he did not know that. Correct.
So sadly, the story has a sad ending. Why don't you just let us know what happened to Brenda?
Yeah, sure.
Yeah.
So to put it just very briefly, because we have limited time, what happened is that Brenda really, really struggled in many ways, socially, with friends, within the family. And her parents ended up taking her to a therapist. Brenda, when Brenda started puberty or got close to puberty, um, he realized that he was attracted to other girls. And this kind of, I think that was the thing that really put him over the edge, and he became suicidal. Now, just so that you know, during those yearly trips down to John Money, John Money was sexually abusive toward these twins. And there were all sort of very disturbing, immoral things that were going on in his office that the parents were not aware of. He would take the twins into his office and force them to take their clothing off and to get into different sexual positions. And it came to the point where the twins were refusing to go down and see him anymore. So this is basically it. So Brenda is moving into puberty. He's placed on estrogen, and he's suicidal. And the psychologist, the local psychologist or psychiatrist that's seeing him, tells the parents that they must explain to him his history, and they must tell him what happened as a child. And so they do this, and it's very moving. You can see the parents talking about this on YouTube. There's movies on YouTube about this in which the parents explain what it was like. And basically what happened is that Brenda slash Bruce states that when he heard the truth, he was incredibly relieved. He was so relieved that he wasn't crazy, because he was clearly, for many, many, many years, he was struggling. And he did not feel like a girl. And he thought that he thought there was just something so wrong with him. And so he was extremely relieved to hear this. He immediately wanted to live as a boy. He immediately he changed his name. He didn't change it back to Bruce. Very interesting. He picked the name David. And the reason he picked the name David is that he said all his life he felt like he was David fighting Goliath. And Goliath would have been John Money and his theory that male and femaleness is completely separate from biology. So David was fighting his biology, and that was like fighting Goliath. And that is such an important message right now to be heard. So essentially, the long and short of it is that it sounds like it could have ended up okay, but it really did not end well. And many years after that, the brother, Brian, he died of a drug overdose. And a few years later, David himself, even though he had married, he had adopted some children, his wife's children, he had found work, but in the end, he committed suicide. So this is the story of a family that was destroyed by a
deviant. I mean, clearly he's abusing twins.
Yeah, I mean, if you the synopsis of this is, it's junk science, because it's just a weird theory that he kind of pulled out of the sky, and he's clearly a pedophile. I mean, like that, so you have it, but and again, this is a very powerful message. When you have something that kind of sounds sciency, but it's promoted by somebody who obviously is very charismatic and writes prolifically and is articulate, and then gets picked up by the media of the day. It's unbelievable how powerful,
Well, how much momentum it gets, and
and
then it
and
lasts for years
like it
and
just
decades to come.
so we start with this, which starts in junk science with a sexual deviant, and now even in our rural area in conservative rural Oregon, we have 7th and 8th grade kids that get upset when one of the nurses goes and asks them to fill out a form for a class, and that there's only male and female as the two genders that they can pick
Correct.
from.
So
Well, let's. I
wanted
want you
to
to
just. Oh, go ahead. Go
Okay.
ahead.
This whole story that I told you that his experiment with the twins was a hoax did not come out for decades. Okay, and it finally came out in the 1990s because there was another psychologist, Milton Diamond, who dug into this, and he discovered the truth about what happened to the twins. And then it became the book that I mentioned, the As Nature Made Him, that revealed this entire fiasco, only came out in 1999. So in all these intervening years, these ideas, this false notion of John Money's gender theory was institutionalized within a whole field of medicine and a field of psychology, sociology, education. And so it was able to just become the dogma.
Right. So I like to play devil's advocate a lot when we talk about things. But the first thing I'm thinking is, even with this flawed, way of thinking and this theory that he's trying to prove, can now, where we're at, people be thinking, okay, so here we have this child that is got XY chromosomes, and he's raised as a girl right from birth, but inside he feels like it's not right and he's male. I mean, therefore, he knows intuitively that he doesn't feel like a girl, and he should be able to choose maleness. So even though it's founded on, chromosomes, are people now sort of using that part of it as a reason to substantiate the fact that kids should be able to choose whatever they feel their gender is? Does that make sense? So it's like Brenda felt like a boy, even though he was raised as a girl. Therefore, the kid next door, if they feel like they're a boy, even though they're born a girl or raised a girl, they should be able to choose, because that is where their brain is going and their mental health is going. Like, I know what I feel inside is the right answer, but is that what the community, what psychology, the people that support transgenderism are using that as the basis? Is whatever a kid feel? I mean, it just seems like fairyland, but it's like, if the kid feels that way, then therefore, and this is pre-puberty, mind you, therefore it should be whatever they feel as what their gender is.
Well, the thing is, though, that you see, since John Money's theory was developed, it's gone through many, many iterations, and it's actually, it's not the same. It's been kind of turned into something very, very different. The reason why I bring up John Money when it comes to gender is because he coined that term in a way that would apply to people, and he came up with this idea that biology and the way that we see ourselves, the way that we identify, are two different things. So, but through the decades since all this happened, there's been many iterations, and the way where we stand now, it's almost, I think that if John Money was around, I don't know what he'd say at this point, because even John Money argued that that gender identity is fixed by age 3. And that's why he was telling the Reamer family that they have to hurry up, because the twins were like 1.5 or 2 years old, and they were saying, and he was saying, look, if you don't start raising this child as a girl, by the age of 3, it's going to be fixed. His identity as a boy. So I don't know what John Money would have said about 15 and 20-year-old people who, like, within a week or a month or 6 months, you know, decide that they're going to identify as the opposite sex. Do you see what I'm saying?
Right.
It's
Right. Where we're at now, I mean, is a whole different ballgame than kids who are 4 deciding that they're a different sex, which
Right, but
I would like to get into that. I mean, as far as true, what is the numbers, do you know, on like kids that are pre-pubertal truly identifying as the opposite sex of their genetic chromosomal DNA? That's pretty small, correct? Like I read that it's usually males, and it's usually like this minute percentage of the population across the world.
Yeah, well, this is, what we used to call gender identity disorder, and it's been known to the medical profession for a long, long time, even though it's extremely rare. I remember hearing about it, I guess, as a child, doing my child psychiatry rotation, but none of us thought we would ever see anybody. It was like a textbook thing that rarely, and you asked for the absolute. Yes, it was let's see, it would occur in, the sex ratio was 6 boys to every girl. So
Right.
much more common in boys, but even among boys, it was something like, I think, 1 in 30,000. I mean, it was rare. Well, it
Right.
was a rare condition.
right.
So that's what, look at, I guess I'm thinking in my head, it kind of dates us, but we were in medical school in the 80s, late 80s, 90s. And, we heard about that too through our training. It was one of these super rare phenomenon that happened. But fast forward to, doing all of our education, family practice, I had seen up until, I don't know, 2010, 2011, 2 people ever. Both were males that transitioned to female, didn't really even know it until this patient comes in for a pap smear. And I'm like, this makes no sense. It's, John Doe. And why is John coming in for a pap smear? And then the first patient I had like that was like, wow, okay. John used to be female, still has a cervix, is proactive about his health. I mean, he didn't have surgery, but it was like a big eye-opening thing. And so I had 2 patients like that I'd ever had encountered, seen, even though we had learned about it at school. I don't think Tim had come across any at that point. Then, like, all of a sudden, the needle tips slightly to the right, and we can't go to school, to work a week, and you're continually bombarded now with having to struggle what pronouns to use for people that aren't sure if that are bi, and questioning and transition. And now it is like an everyday phenomenon. So as a person, even outside of science, and as a doctor, I'm like, what the heck is going on, where this was a rare phenomenon that was, something that could be written up, to now you turn your head every which way and direction, and it's like catching. It has to,
and it magically
to
is
me,
young
that is
young
not,
women who are magically they them, when it was 6-to-1 ratio in sort of traditional gender dysphoria, and now it's like it's all teenage women. It's it's the anorexia of 2020.
Okay, so let me explain. So, those little kids who either say that they wish very much that they were the opposite sex, or that they are the opposite sex, that is a very different group than the kids we're looking at now, who are either, you know, just going into puberty or they're already in puberty. This is a very different demographic. So we do have studies on those younger kids because they've been around a long time. And we have studies, for example, out of Toronto, Dr. Zucker's group, and we have studies from the Dutch, who were looking at these kids, and we know that these are the young kids, okay, the kids who present when they're 4 or 6 years old, or even younger than that, who have consistent, persistent beliefs, and insisting that they either are the other sex or they want to be the other sex. So we know that those kids, if they are permitted to go through regular puberty without affirming them as the opposite sex, we know that the vast majority are going to accept their bodies and get comfortable with their bodies and no longer wish to be the opposite sex. And those numbers are very high depending on the study. They're like 68 to 98% or something of these kids. But those are kids that are not socially affirmed. And those are kids also that have been studied, whose emotional issues and the problems that may be occurring within the family are attended to and are treated. So we know that those kids don't, in general, there are some that end up transitioning, but the mass majority do not and have no need for that. Now, the problem is that the statistics, that you see, we don't yet have good research on this current cohort of kids, that we have on our hands a psychic epidemic. Okay, it's not the first one, it's not the last one, and as you mentioned, Tim, about anorexia, and there's been other psychic epidemics in the past that have been written about. And so now we have this psychic epidemic in which kids are hearing about transgenderism and they're latching onto it as a way to express their distress.
Right. And, May and I have had this discussion, which is, if you're, going through puberty, you're 12, 13, 14, 15 years old, depending on your sex, because, men tend to mature later, right, May? So,
or not at all.
or not at all. And so, the thing that's fascinating about this is it's like, well, do you feel like you're in the wrong body? Well, yeah, because I went to school. I'm 12 years old. I'm still a child. And all of a sudden I started bleeding from my uterus. Yeah, I feel like I'm in the wrong body. Or, I'm a 14-year-old male who just is, happily walking through gym class in his ugly shorts that everyone has to wear. And like spontaneously, you are all of a sudden, a massive tent pole trying to hide yourself from everybody else. Yeah, I mean, the fact is that part of life is a transitionary period, and it's horrible, and it's horrible for everybody, and then you add to the fact that now you're supposed to compare yourself to, an Instagram model, and you don't have real relationships. You have, online relationships. Add to that what we did in COVID with, shutting schools and no sports and all. And you go, well, no wonder people are screwed up. I mean, you ask anybody at that age, are you in the wrong body? It's like, yeah, I don't know what my body's doing. It just does all this random stuff and it drives me nuts, you know?
Well, that's of course, and you have to understand that when you, on top of all that normal angst, teenage angst, when you put it on top of pre-existing, comorbid psychiatric conditions like um, anxiety, depression, autism, and any number of other things, family issues, and so on. Of course, you have a perfect breeding ground for the spread of this psychic epidemic. And I'm going to also mention that when kids are told from a very young age, and we have books now for really little kids, telling them that it's possible to be born in the wrong body. As Jazz Jennings would say in her book, I was, I had a girl's brain in a boy's body, and that book is read to little kids. Then yeah, I mean, they're just exposed to this over and over and over again, and now they're seeing, drag those performances in public libraries with drag queens, and it's all being celebrated. And isn't this great? And isn't this beautiful? So a child who feels insecure and a child that feels anxious about themselves socially and doesn't have friends and isn't accepted, well, of course, coming out as transgender, and that's celebrated, and that's like, oh, you're so brave and you're so wonderful and we support you. Well, of course, that's a part of all this.
So I know we're running low on time. The part that still just baffles me, as I said before, about abortion, and where there's kind of a logical motivation to want to be able to have access to abortions. What I don't understand, and maybe it's just too big of a question because no one really knows, but who gains power? Who gains influence? Like, what's the motivation for this? Like, do you have any idea? Because, like, I just don't get it. Like, confusing children doesn't seem like a really good plan for a stable society. And, one of my own theories is I wonder if we just want to emasculate the society, because, yeah, there are toxic males like John Money's father. But what we really need is strong men that are willing to do violence on the side of righteousness, but at the same time are kind and can be truly meek and bridle their aggression. And it's like that. It's like, since the last 60 years, we're just trying to drive this sort of masculine, real men, real fathers out of our society. And I'm like, that's a bad idea.
Well, there's no question, Tim, that this is extremely destructive, not only to the children and their families, but to all of us, of all of society. And like you said, it's very important to have a strong identity. And when we present these ideas to children, and we encourage them to question something that's at the core of being human, which is male and female, when we are encouraging them to question that, it is terribly destabilizing to them, to their families, to their communities, and to society as a whole. Now, you're asking, why is this being done? Of course, we can point to one part of this, which is the money. And I don't mean John Money. I mean, okay, well, when kids are medicalized, then they're going to be living another, what, 50, 60, 70 years as patients. They're patients. They are medicalized. They're going to need their hormones every day for the rest of their lives. And many of them are going to have surgeries. And many of these surgeries, as you know, are high risk, and they require other surgeries because they don't get it right the first time, and it's very complicated. A lot of the detransitioners are speaking up and talking about how their health has just been destroyed by all this. So, sad to say, there is a ton of money that's being made off of these kids. Now, if you want to take it even bigger than that and ask, who profits from all this confusion and this kind of redefinition of what it means to be human, I, you may want to get someone else on the show to talk about that. But there are people, powerful people, wealthy people, that believe in something called transhumanism, and they believe that this is the direction that humanity has to go toward, and transgenderism is part of that.
I just, Tim always is questioning the why and what's the motivation behind it. I just, when I first read Abigail Shire, did I say her name right? Book Irreversible Damage last fall. I I had so many emotions, because I just felt pain and sadness and just hurt for these kids and these adolescents, kids in college going through this. If anything else, and it threw me back to my own struggles as a teenager because I was a severe anorexic and then bulimic, and I just felt like it was written about me, but in a new time. Like we talked about it, going through struggles as a teenager. It's a difficult time. There's various traumas that we all have that can impact things, and I just saw this as the new, I guess I would say, like Tim said, the new social thing that's replaced anorexia. It's like you're trying to control things, you're trying to fit in, you're trying to figure yourself out, and these kids are so confused. And I thought, and then I get also very angry at our medical community because there's so many thoughts. Like I think back to what we did to people with mental illness with lobotomy, thinking that was going to cure them by cutting out this healthy part of the brain. We thought it was a cure. I thought, I'm thinking,
or
what
jump starting them with a 18-volt battery. Like
Right.
That was a great idea. Let's do that.
But if someone had have done to me what I clearly I clearly felt I was in the wrong body, I would stare in the mirror and the changes that happen in the brain when you deprive yourself of nutrition, and with the mental health changes that occur with eating disorders. I would look in the mirror, I would weigh myself, I saw something different, and that was my reality. But if someone had come along and offered me a gastric bypass or enabled me, giving me dieting drugs, etc., to continue on what I thought was my reality, it would have ended,
it would have killed you
tragically. And we see that as being wrong, but yet what's happening with this developing brain and kids who are confused and questioning, and suddenly their friend is now maybe transgender, so maybe I am, and all of a sudden it becomes like a social norm. And the fact that physicians and healthcare providers just go along with this and say, oh yeah, if that's what you believe, I'll support that, and whatever you need, it's just makes me furious and hurts for these people.
Well, I do want you to be aware, and you might already, but I've been flooded with emails since my appearance in Matt Walsh's documentary, What is a Woman? I've been getting lots of emails from mental health practitioners, social workers, psychologists, psychiatrists, counselors, saying, thank you for speaking the truth. I agree with you, but I'm all alone here, and I want to be connected with other people that think the same way. And so I've been able to help them out and put together sort of a group of them to support each other. I think that they're, I look, I agree with you, May. There's been a capture of our profession. There's a lack of courage, to put it mildly. There's a lot of fear and spinelessness that really is very upsetting. But I want to add to what you said when you spoke about the kids and the kids and the teenagers. I want to just add, I really want you to be aware that the parents of these kids, who by and large are devoted, loving, responsible parents, um, who are who are just vilified by by the mental health community, by the educational community. They end up fighting with everybody, with the counselors, the teachers, the doctors, the gender therapist, and they feel extremely uh, isolated and abandoned, because they have been. And I want everyone to be aware that the pain and suffering of this transgender movement or ideology or psychic epidemic, whatever we're going to call it, it's creating victims of the parents the grandparents, the siblings as well. So it's much, much bigger than just the kids. Sometimes the parents need more therapy than the kids do.
No, you're absolutely right, and it's horrifying when you know, I can't remember where I saw it on, but that one father from Canada that was put in jail for speaking up against letting his daughter have this to transition and go through surgery, and is actually put in jail.
Yeah, because he misgendered. Yeah, he wouldn't use the male pronouns with her.
No, it's stunning. But I heard something yesterday. I ran into somebody that I was talking to who is a nice community member, and in the town next to us, again, this is Logger Central, not exactly the not exactly a dearth of toxic masculinity. So if using the traditional terms, and there's a couple kids at the local high school that have been identifying as furries, and they put a litter box in the bathroom for these kids, and I'm like, how does that happen? Like, how is that even possible? And it's like, well, we don't know that they used the litter box, but they demanded that we put it in, and since this is their identity, we have to affirm that. And I'm like, they're dressed up in panda costumes, like that. That's either
I mean,
psychopathy or they're just pranking you. There's only
you
two
just want to
choices.
laugh, but the thing is, I don't understand. How does society, how do people that are in charge, how do they go along with this and it's like seriously think this is okay? I mean, when does it end? I mean, then when does my reality and your reality, I mean, versus truth ever end? And
well, I want to identify as 13 years older so I can get my maximum Social Security right now, and Medicare, and then I can just retire a little bit earlier and not have to worry about working. Because there's days when I wake up where I'm sure I feel like a 70-year-old. So why can't I just identify as one then?
Well, look, from where I'm sitting, the body count is very high and it's increasing as we speak. So I think there's going to be a certain number of casualties of all this, and it will be too big to be brushed under the carpet and ignored. That is what I'm hoping. I just hope it'll happen sooner than later.
you mentioned, people finally starting to stand up, speak out, parents and some medical professionals that have been afraid to. I mean, is there any kind of organizations, websites that you can think of, or groups that are starting to form to um, stand up against this, or is it kind of more on an yeah?
Oh, sure. Yeah, of course. There's quite a few now. Um, so you have an excellent organization called SEGM. It stands for Society for Evidence SEGM, Evidence Based Gender Medicine, SEGM. A very excellent group of medical people, not political whatsoever, just bringing the real information about studies, about research that's going on, uh, reports from other countries such as Sweden, the UK, Finland, France, where the medical, where there's been um, uh, announcements and change of policy to restrict the access to medicalization because we just don't even know whether it really helps people or not. So one site is SEGM, SEGM.com or org, I'm not sure, uh, which, YouTube is just full of tons and tons of detransitioners, and Twitter as well, social media, telling their stories. some of them using their names, some of them not.
I just want to leave listeners, whether they're medical or not, and feeling isolated, alone, afraid to speak up, or parents listening to this, or whoever, that they're not, because so many people feel so isolated and alone and afraid to speak up for all the ramifications, being pegged, or even losing employment over things like this, or whatever it may be. I want people to have some hope and a place to go where they can get some good information. Also, I encourage people to read Irreversible Damage. But tell us about your website as well, and we can find you and your books too.
Okay. My website is miriamgrossmanmd.com. I have there lots of articles that I've written recently, videos that I've made, lectures that I've given. So that's miriamgrossmanmd.com. Please follow me on Twitter, which is Miriam underscore Grossman. And I'm also on Facebook, which is just Miriam Grossman, MD. I do want to encourage people that to get educated and to learn as much as they can, because the science is on our side, and the other side has ideology, and the other side has activism and loud, aggressive voices, and they act as if there's a consensus, and they act as if, like Dr. Marcy Bowers in the documentary, in Matt Walsh's documentary, Dr. Bowers was asked if there are people that disagree with the prevailing narrative, and Dr. Bowers said, if there's a few dinosaurs.
I know. And I saw that. I'm like, this doctor must live in a 1-block bubble, like shop for their groceries there, do all their work there.
She's in San Francisco.
I was like, who is this? It was almost laughable.
Bubble. San Francisco. It's now a bubble of human feces. So, whatever.
I just want your listeners to know that there is no consensus, that there is a debate in the medical, psychiatric, mental health community that is going on right now. Florida has just announced that Medicaid will no longer pay for medical transition, hormones, and surgery because it is experimental. And this is exactly what Sweden has also said. Sweden is the most GLBT friendly country on the face of the earth.
Well, that was truly a mind blower. We both feel that we just barely scratched the surface.
I know.
There's so much. There's so much kind of community crazy that's going on with this that it is like jumping into a cool river on a boiling hot day to listen to somebody that actually has seen patients for decades, understands what's going on, and is still willing to fight. And I think that's a big thing, man. The no courage, and we've been kind of trying to confront that in our own, dopey BS-free way for the last year, which is, doctors, like, nut up, get some courage, because this is ridiculous, man.
In true science form, there should be a discussion of things on both sides. No side should be silenced, and especially with this transgender issue going on, where I see like most of it being pushed by the non-health community, but I'm like, where's the other side? Where's the other side in this debate, this discussion?
But whatever happened to just discussions? Like, I remember when we were in medical school and we're in Canada, and you see this like insanity in Canada where this guy misgenders his kid and gets thrown in jail for it. Okay. Well, when we were in medical school, they would just have speakers speak about abortion, and they'd come out there and they'd have a pro-abortion guy. And then, somebody in the audience was very pro-life and would start, they'd almost be screaming at each other. And I'm like,
Gee,
that's
that
actually
used to be
super
called
healthy.
debate club in
Yeah,
high
I mean,
school.
it's like super healthy. And they talk about any kind of controversial stuff, and there'd be people. I mean, my favorite was the psychiatrists would come out and they'd do grand rounds and they would start presenting a really complex case, and it would end like not in fisticuffs, but like verbal fisticuffs, like
But
that
nobody
person is multiple personality. No, they're this. No, they're that. And I'm like, that's healthy. That's what's supposed to happen.
Nobody was silenced, excommunicated, or
lost their job,
shut down, put in jail, or canceled all their social media. I mean, it's crazy. And they weren't labeled as phobic of whatever they're arguing.
Yeah,
against.
I mean, they might have been labeled as like that guy's kind of a socialist pig, or that guy's a religious zealot, or whatever, like in cocktail parties. But it was like, you still worked with them. You still sent each other patients. You still understood that you had opposing views on some big issues, but that you could still understand that the person was clinically competent. Like I just like it just it and like again, I just don't get it. We talked about this morning, and it's like, I think what courage is you got to be willing to let people call you names.
Mm-hmm.
Like you stand up to this, and it's like, you're a transphobe. Okay, I don't even know what that is, so I don't care, because I don't fear trans people. So I don't fear you calling me something.
I fear the people pushing the agenda more than I fear.
Oh no, I have.
Anything
if you have anything but compassion for these families and these children, you are a monster.
Exactly.
Like, I cannot imagine. I mean, you've had a body dysmorphia, okay? And we have obviously discussed this in detail, privately and publicly on the podcast. So you understand the personal pain and where the trauma that can lead to those kind of psychic phenomenon. All right. But here's the deal. If you hate your body so much that you literally want to cut your genitals off, those people deserve nothing from us other than compassion. Period.
Absolutely.
Okay. And I don't fear them. Okay. I fear these people that somehow have politicized and made this into some sort of power agenda. And again, you're teaching vulnerable children that they might be in the wrong body, they might be this, they might be that, and like sowing all this doubt and sowing all this like it gets crazy. Like, what would happen if you went into a elementary school, and instead of saying that maybe you're born in the wrong body, you just went in and you took a very, very fundamentalist approach to evangelism, and every kid got the tracks that we got back in the 70s of burning in hell. And so little Johnny, you're born into sin, and unless you say what I say you need to say, you're burning in hell. Like, how long would that last in school before like everyone lost their minds and said, you can believe that, but this is not age appropriate for 5-year-olds, and maybe you need to dial back the rhetoric and have Bible class not during class.
Well, we've gone
like that would happen in 2
from
seconds.
Not age appropriate to everything's age appropriate.
Right. And it's this ongoing sexualization of children, which just is it's not offensive. It's disgusting. And it's nothing new. Like, it's nothing new, okay? Like, for millennia, we've been sexualizing children. And when we look back at other societies and go, in the Middle Ages, they like to cut little boys' testicles off so that their voices stayed high and they could sing nice. And we look back at that and we go, that's monstrous, okay? And, you look at the Roman times and all of this where, children have been used, there's been sexual predators of children forever. But somehow now it's leaking back, and people aren't absolutely losing their minds because they're scared that someone's going to call them a name.
Yeah.
Really?
I think it's monstrous what we're doing to kids with the puberty blockers. And
well, we didn't even open that can.
And pretending that it's just putting things on pause, to quote someone.
When I would work up patients for infertility, and we had the discussion of Lupron, okay, which is one of the drugs that's used as a puberty blocker. I would tell the patient, I would say this drug is the atomic bomb to the female endocrine system, because we are going to shut every hormone off. And then we're going to kind of hope that we control alt delete the system, and then it comes back normally. Then we're going to add some other drugs, and we're going to see what happens. And if that doesn't work, you go to the fertility clinic. But like, we'd start people on it, and we'd be like, you're going through, like, I know you're 25, but you're going through menopause.
Any woman,
because that's what Lupron does.
On Lupron will tell you how horrible they feel, what it does to them, and then the long-term side effects are not benign.
And we're going to give it to a 13-year-old because they're wondering, because they play with trucks too much.
Yeah, well, I like that quote from who was it? That comedian that said,
the Bill Maher quote that says, this is a rough paraphrase. I don't have it right with me, but he said, if we're going to let 8-year-olds decide what they're going to be, then we would have lots of princesses.
He said, I would have been
lots
missing
of
an
cowboys.
eye and a leg because I would have been a pirate.
And lots of cowboys. Because when I was 8, I wanted to be a pirate, and I'm really glad no one sent me for eye removal and peg leg surgery.
Exactly. Yeah. Well, all I have to say is we mentioned the documentary is it on Rumble, Tim? Matt Walsh's.
No. It's on the Daily Wire.
The Daily Wire.
You're not watching anything produced by Ben Shapiro without paying for it.
Well, that is I don't know. Get a group of friends together, somebody that has it, and it's worth paying the subscription just to watch that. What is a Woman? It's amazing. You don't know whether he'll laugh continuously or cry for how insane some of these people are. Dr. Grossman is in that, and it's amazing. And
just to end this up, I want to try to. We have to be really careful, because we got to fight for children and for our society, but we also have to be really careful that we fight the right people, because I get nervous. It's super easy when I see a kid come into the office they all have like purple hair for whatever reason. That seems to be the thing, and they're they, them, and whatever, and I feel this anger rising in me. And the fact is that that's not appropriate, because to be angry with that confused child is wrong, and it's unhelpful. And in some respects, they're being used as human shields for these unscientific political forces that are behind them. And so it's important to recognize what we're fighting. And I think the other thing to recognize is as Dr. Grossman said, there's going to be a high enough body count where people actually start to get pissed off, and then it changes. And when that happens, we need to be a graceful landing spot for people, and not be pointing our finger in their chest and yelling. It's like, why didn't you do something sooner? When the response is, thank God you did something ever. And that's, great. Grace, forgiveness, and still fighting like hell, but fighting the right people, I think, is really the bottom line, because we should be encouraged, because the science is on our side. And I think that is a very, very powerful place to be. It's we get so angry about this because we've had kids, we've taken care of kids, we've been kids ourselves, and we know the level of adolescent suffering, and that should not be used for political gain. That is just despicable, just horrific.
Absolutely. Perfectly said. Love it. So I will link all of her information in our show notes, as well as the other websites where you can look for support, some recommended reading, the Matt Walsh documentary. And if you like this episode, share it with other like-minded believers and thinkers, so we can just keep reaching people and helping with this important subject matter. And thanks again for being here. Send us your comments, questions, and any suggestions. See you guys next time.
It's no secret that medicine is a bit uptight. That's why Tim and I created BS Free MD. to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS3MD. See you next time.
But we try to keep BS3MD as raw and real as possible. We can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bs3md.com.